Good morning, everyone, and welcome to the 36th Annual Aging a Family Affair. I know this is, for those of you who've joined us for our past years of Aging a Family Affair, you know this looks very different, but we still wanted to bring you quality content that you've come to expect from our Aging a Family Affair events. So thank you all so much for being here today for the last of our three-part virtual workshop series, and you are certainly in for a big treat today. Just a few housekeeping items before we get started. First of all, I'm Dottie Livers with the Office on Aging, and I will be your host today. If you have, for those of you that are joining us on the computer, you are welcome to enter questions of our speaker in the chat function. For those of you calling in, we also have an opportunity at the end of our presentation for question and answer. Right now, everyone is muted, and you will be muted during the duration of the presentation. That will help us with background noise and to prevent or allow everyone to hear. We will open the lines at the end of our presentation so that you all can ask questions. So be thinking of those if you have them as we go through the presentation. If you are joining us with a computer camera, you are certainly welcome to turn that off. Not that we don't want to see you, but you are certainly welcome to turn that off as well. If you have any questions, you can reach out to me through the chat function as well in the presentation. But we are looking forward to hearing Dr. Crane speak today. So with that in mind, I'd like to welcome our speaker today, Dr. Monica Crane. Dr. Crane, for those of you who may not know her, is a fellowship-trained geriatric medicine physician who has been nationally recognized as an expert in dementia care. Her career focus has been on clinical care, treatment, and support for patients and families affected by Alzheimer's disease and related dementias. Dr. Crane is the founder and medical director of Genesis Neuroscience Clinic, which is a multidisciplinary memory disorders clinic. The clinic provides community care for cognitive disorders and the neurodegenerative dementias. In 2020, Dr. Crane started the Tennessee Memory Disorders Foundation, which is the nonprofit parent organization for the clinic. The foundation's mission is to provide support for comprehensive community care for those with memory disorders and to mentor students and professionals to become future leaders in dementia care. So again, I want to thank our speaker, Dr. Crane, and welcome her today. Again, everyone is muted. You will remain muted for the duration of our presentation, and we will open the phone lines after she is done speaking. So let me switch gears here real quick, and we will get started.
For joining us today to talk about Alzheimer's disease, normal aging, and prevention. These are my disclosures. I'm going to start with a little bit of medical history to set the stage. If the belief that cancer cannot be cured fuels fear, how are you going to seek treatment? If I believe that the cancer I have will not be cured, will I delay treatment until it's too late? It sounds a lot like Alzheimer's disease. Growing up, I remember when cancer was the C word. We had a neighbor that had cancer, and ultimately she died of that cancer. I don't know what type she had, and I'm not sure if she did either. So what happens is people delayed care. This is a graph all about breast cancer. Mammography was refined in the 1960s, but it wasn't until 1976, where you see that big red arrow, when the American Cancer Society mandated screening. The funny thing is that the doctors were the ones that were the biggest skeptics. They said, well, women are going to die anyway. And sure enough, they did, even after screening. It took about a decade for good treatments to emerge, meaning we had to detect disease before you could have a palpable tumor. We had to detect disease on screening before you had a symptom in order to develop a cure. And as you can see, breast cancer deaths have really come down tremendously with each improvement in treatment. So what is normal aging? There is such a thing, and the main thing is that we all slow down. We're slower to think, we're slower to find words, we're likely to look before we leap. We may know the person and not the name until probably a week later in the middle of the night and you wake up and you say, aha, I remember their name. We may pause to find words, but eventually we find that favorite word. Not normal aging is not being able to function, not being able to do day-to-day activities. You can't place the person. Words don't come now or even later. Sometimes I get asked, well, is it Alzheimer's disease or is it dementia? Well, the word dementia isn't really a diagnosis. It's a syndrome. It's an umbrella term, and under it are about 100 subtypes. Alzheimer's disease is the most common subtype, but there are many other subtypes of what we call neurodegenerative diseases. Frankly, I don't like the word dementia because it doesn't really define much. Instead, I prefer the word neurodegenerative disease. It's a degenerative disease of the brain. So what is Alzheimer's disease? Alzheimer's disease is, again, the most common primary neurodegenerative dementia, and it affects about 50 million people in the world, and it's projected to affect over 150 million people by 2050. Early onset Alzheimer's disease affects a much smaller population, but it's still likely under-recognized. Alzheimer's disease affects short-term memory, cognition, behavior, mood, and daily function. Alzheimer's disease is progressive. It's defined by plaques and tangles on autopsies. So here's the fundamental problem. How in the world do you diagnose a disease that's 100% confirmed at autopsy? Right now, we're not doing a great job. We're doing a better job of recognizing Alzheimer's disease, but we're still seeing patients more and more in the dementia phase. So think of it like having an overt cancer that's metastasized. If you look way over to that severe stage, if you had a severe cancer, the chances of cure are going to be limited. We're much better at diagnosing MCI, which is mild cognitive impairment, but ultimately, just like we diagnose cancers on screening, we need to get to the point where we diagnose preclinical disease. That's before there are any real symptoms and before there's clearly an effect in day-to-day life. A lot of times we get asked, well, what about my family history? Everyone has Alzheimer's disease. Luckily, very few of you will have what is dominantly inherited Alzheimer's disease. The most common subtype is late onset, which is defined at age 65 or more. So if you're age 65 at the time of diagnosis, that's considered late onset. And it's the most common subtype. Also common is what's called early onset complex inheritance. It's the similar pattern of inheritance as the late onset, although it's thought to be that certain genetics play a bigger role, but it's not genetic destiny, meaning that you're not 100% going to get Alzheimer's, even if there's a family trend. It's kind of like families having cancers in their families or diabetes. Not 100% of everyone has necessarily diabetes, but there's a trend. The most rare type, and the type that you don't need to worry about having, is called the familial early onset or dominantly inherited Alzheimer's disease. It's extraordinarily rare. Usually 50% of a family is wiped out by this subtype, and the age of onset can be as young as the 20s. And generally, patients will die by their 50s or 60s. And again, it affects 50% of those families, and if you have the gene, you will die. So luckily, very few people in the US have this. In fact, it's so rare that there's a study of a village in Colombia, South America, that carries these terrible genes. So again, looking at some of the genetics that we have to worry about, the biggest ones are ApoE4, apoepsilon allele 4, and ApoE protein circulates in the CNS, and it helps regulate cholesterol metabolism, lipid metabolism, and cell repair. E4 carriers have a higher chance of stroke, heart disease, plaque in the arteries, and carotid artery disease, and vascular disease. Luckily, more common is just having one of these genes. You inherit one from each parent. The most common subtype is called ApoE3, which is neutral. ApoE4 is detrimental. And as you can see, that if you have two of these genes, one from mom and one from dad, your risk goes way up. But luckily, it is not the most risky subtype. So it increases your risk of both early onset and late onset disease. And ApoE2 is thought to be protective. ApoE3 is neutral. The positive story is even if you carry this bad gene, it is modified with both diet and exercise. Carriers of ApoE4 who engage in a lot of aerobic physical exercise have a reduced risk of Alzheimer's disease. Also, ApoE4s who abstain from alcohol can also neutralize their genetics. ApoE4 carriers also benefit from a low-fat and Mediterranean diet. So again, even if you have two of these bad genes, one from mom and one from dad, your risk of Alzheimer's over your lifetime is only around 50%. And the positive news here is that the other 50% of those that have this bad gene never have Alzheimer's disease. And it's thought again to be based on lifestyle factors, which is so positive to know that even with bad genes, you're not doomed. So Alzheimer's is a mix of environment and our genetics. We can't get away from our mom and dad and our families, but we can modify our environment. So looking at this chart, it really demonstrates sort of the different ways we can detect Alzheimer's and the places we don't want to detect Alzheimer's. We're very good at detecting symptoms. So clinical function is the far purple line with the first arrow. And again, that is someone who's clearly impaired. We do not want to wait until someone is very impaired to diagnose. So that was kind of the way we diagnosed in the past. We waited until someone was so symptomatic. Another way is to do cognitive testing, but you can see that it isn't very sensitive. If you follow that dark blue line, you can really only detect in late mild impairment. We're still missing the pre-symptomatic and the earliest mild cognitive impairment. The next arrow points to MRI findings. So you can find what's called hippocampal atrophy, which is a specific finding that I'll show you pictures of. So if you ever have an MRI, you'll know what we're looking for. And this is a finding where the memory center is shriveled. And you can clearly see this in early MCI, late MCI, and the dementia phase, but still not that sensitive in people who are silent carriers of Alzheimer's. Another test we can do is something called an FDG PET, or a PET scan of the brain. And I'll show you pictures of that too. We can detect early MCI. Newer on the research front and now available, approved by the FDA, is something called an amyloid PET, where we can see plaque in the brain before someone has symptoms. Unfortunately, it's not covered by Medicare, even though you can pay for it. It's quite expensive. Still used in the research setting. This is going to be one of the most hopeful markers because you don't have symptoms yet. Again, that pre-symptomatic phase is the idea of screening someone. But that's an awfully expensive test. This is something that people dread the most. That last red arrow pointing to the red line is spinal fluid. Guess what? It's a great way to detect amyloid plaque. I just got back from a virtual conference and we talked about plasma and serum biomarkers. So the hope is, instead of everybody doing lumbar punctures, which doesn't sound like a whole lot of fun, even though I like the test personally, there will be blood tests. Are blood tests going to be 100% accurate? No. It's like getting a cancer screen on a blood test. It might detect something, but I think it's a great start. If we all end up getting blood tests, and if you are indeed positive, maybe confirming it in the future with some of these other tests will be the best way to go. But I do believe in the next 5 years, we will have the availability of a blood test to look for Alzheimer's and confirm Alzheimer's disease. So what about the memory and smells? You may have heard of people that are having difficulty recognizing smell or not tasting food. Unfortunately, most of taste comes from our nose. All of us have had a cold before where we can't smell our food and everything tastes blah. So what happens is there's a certain memory center and an olfactory bulb that are interconnected. Certain smells can involuntarily transform us to a place in time, to a memory that is much better than a photo. So why does a picture not transform us? Well, when I smell lavender, that receptor goes from my nose to the olfactory bulb. So those are the nerves for your smell. And it's only one synapse away from the amygdala, which is our emotional memory, and 2 synapses to the hippocampus, which is our short-term memory. It's the where and when parts of our brain. So what happens is when I smell my grandmother's lavender, I get a warm feeling, amygdala, a positive emotion, and then my hippocampus says, aha, it's my grandmother. She has long passed, but that memory and that beautiful image lives on. So this is an anatomical cartoon. Remember you saw that picture of the nose and that arrow that pointed to the middle part of the temporal lobe? That's where that hippocampus lives. So I'll back one, and you can see the hippocampus is right above the ear. And again, that's where the memory center lives. And that is the where part of the brain and the what part of the brain. It works in association with the parietal lobe. You can see that red area in the back of the temporal lobe that gives us our visual memory. So many times along with that memory, we have a story. It's almost like a movie that's replayed in our mind. In typical Alzheimer's disease, you have atrophy or shrinkage of the temporal lobe and the parietal lobe. So if you look at the colored image of the MRI on the left, you can see the yellow, that's the temporal lobe, and the blue is the parietal lobe. That's a normal, healthy, aging brain. And the one on the right is an actual MRI of somebody with Alzheimer's disease. And you can see there's this big white space in the middle where there should be a lot of gray. That's where the hippocampus has atrophied. Also in the parietal lobe, note that you see these sort of finger-like projections and cracks. Where you see the white, you should have more of that dark gray tissue, that brain tissue, and that's also atrophy of the parietal lobe. So it's the what and the where parts of our brain that shrink, and that's why people have difficulty in finding objects. So for instance, if you don't have that movie in your brain, imagine trying to retrace your steps to find your keys or glasses. Most of us can kind of close our eyes and backtrack, but in Alzheimer's disease, poof, the memory is never there. So it almost feels like somebody has stolen or snatched our belongings. Alzheimer's disease, again, I mentioned, is detected on autopsy. Terrible way of diagnosing a disease. We call the different dementias proteinopathies because basically it's not some mysterious disease. it's literally clumps of normal proteins that are now grouping and gathering together in an abnormal way. Think of it like cancers. We all sort of understand that cancer cells once were normal. Now they're growing together in abnormal ways. Very similarly, normal proteins now clumping abnormally. So we see these clumps of amyloid plaque and then tau protein tangles. These are pictures of what I mentioned earlier, PET scans of the brain, FDG PET scans, which are approved by Medicare and widely available, and that tell us how your brain works. It's different than an MRI in the sense that we can actually see the brain function and look for neuronal dysfunction. So in the normal brain, and this is a top-down view, if you can imagine with your head back on the table, looking up to the sky, we're looking at 55 different layers of the brain. And you want the brain to light up and be red hot. So the cold colors, the cooler colors are not so good. The hot colors are very positive. In the sort of centers, you see the purple. That is a normal looking brain on the left. That purple is in the sort of the deep parts of the brain where normally you have spinal fluid or CSF. And if you look at the mild cognitive impairment, that middle picture, you can see that there's green, and that green implies a loss of activity. That's not good in the brain, and that's in the parietal lobe. And then in Alzheimer's disease, on the far right, you see areas of blue. That's really bad. That shows us considerable damage in the parietal lobe. We don't see the temporal lobes on this picture, but on a different layer, you would see temporal lobe hypometabolism. Remember, I mentioned that virtual biopsy or amyloid scan that can detect the plaque before you have symptoms. This is an incredible tool that is FDA approved, but not really covered. We did a trial with 126 patients in Knoxville that was sponsored by Medicare, and it did appear to detect plaque, and it changes outcomes. So it's an amazing test. It will be used for FDA approved Alzheimer's drugs. And again, we do have hope in the future. On the left is a negative scan. So you see a little bit of red. Unlike the FDG PET, the glucose PET, on an amyloid scan, you don't want anything to light up. You want everything to be blue and green. And so you normally have what we call artifact kind of in the middle of the brain, but you can see that positive scan where it's red hot at sort of the outer edges of the brain in the cortex. That's what we call the cortex, where the neurons live, and that's no good. That is a positive scan. That is someone who has Alzheimer's plaque. I'm going to present a case of a young gentleman who was fired from work at age 55, and it was thought that he had a midlife crisis or maybe mental health problems. But on his mini mental status score, you can see towards the middle on that word says recall, he could not remember the 3 words. In addition, he had difficulty in repeating a simple sentence and was unable to copy intersecting pentagons. And this is a sign that he's having difficulty with his temporal lobe. Remember, I said the hippocampus is in the temporal lobe and it affects short-term memory, and clearly he's having that problem. This is a subsegment of his Montreal Cognitive Assessment, which is the MoCA test. And if you look at the very bottom on delayed recall, he had tremendous difficulty with delayed recall. Even with cues and multiple choice hints, he had a difficulty answering these questions. He has a diagnosis of typical early onset Alzheimer's disease. Even though some family members have Alzheimer's, he does not have the genetic type of Alzheimer's that is genetic destiny. So it's common in his family, but it's not an inherited dementia. The good news is that we can fix a lot of Alzheimer's. 40% of Alzheimer's cases in the US are from fixable risk factors, meaning environment and not genetics. Now, some of these we don't have 100% control of, like one of the earliest risk factors for Alzheimer's is low education. And clearly, as a kid, you don't have control over this. But it goes to show us that whatever we learn, even if you forget it, and even if you think that one class was pretty useless, guess what? Education, getting a higher education, is phenomenal for the brain. Education up until age 20 is essential. And why is that? It creates redundant pathways in the brain. Think of it like extra back roads just in case the highways are broken. Some other risk factors that are newer, and this is again a newer finding, we did not realize that hearing loss and Alzheimer's were so interrelated. We think it's a stressor on the brain. If you don't have enough information going in, it's going to affect the neurons. And interestingly, if you have hearing loss at age 65 or younger, and you go ahead and treat it, it appears to hold off Alzheimer's disease and in fact improve the brain. So with this new evidence, we are all compelled to go out and get our hearing aids if we're having trouble. I sure will, because it does appear to slow down dementia risk, and having severe hearing loss increases your risk of Alzheimer's 5 times. That's 500%. So hey, those darn hearing aids are probably worth it. Another new risk factor is hypertension or high blood pressure. Now, some of you may say, hey, I have white coat hypertension. My blood pressure soars when I'm in the doctor's office. Well, guess what? When that person's honking at you, and when someone's about to pull in and hit you, or when you get a stressful phone call, our blood pressure is probably spiking too. So I say, if your pressure is 180 because you're a little stressed here in the office, imagine what happens when you're at home and stressed. So I really encourage aggressive treatment of high blood pressure. And the goal is less than 130 systolic, even in persons up until age 85. So age is not a cutoff. Just because your pressure has always been bad does not mean you should let it continue to be bad. And less than 130 is protective to the brain. I'm not suggesting you should get a blood pressure down to 100 or even 120, but less than 130 is beneficial so that when you are stressed, it doesn't spike to 180 or 200. And it does appear that untreated blood pressure causes brain atrophy. It's a stressor to the brain. It causes ischemia or hemorrhage, meaning that the white changes on the brain, that we see that white scarring or even bleeding on the brain, as well as plaque deposition. So think about it. Every day we have uncontrolled blood pressure, we're putting more amyloid or Alzheimer's plaque in the brain. Another thing that's associated with Alzheimer's when we are 65 and younger is obesity. And how can we mitigate this? We think that eating the Mediterranean lifestyle, not a diet per se, so it's not calorie counting, it's just eating the rainbow, equals a good brain and appears to hold off Alzheimer's disease. There's a large meta-analysis of 1.5 million people done by the RAND think tank, and they found that it decreased Alzheimer's significantly. So just eating good fruits and vegetables. Again, it's so hard to eat this, but trying to avoid fast food, trying to avoid the junk food section, eating around the perimeter of the grocery aisle. And guess what? Frozen vegetables, frozen fruits are equally good. So it can be very expensive to buy healthy produce. So if you go to that frozen food section, you can get items that are inexpensive and very healthy. But be sure to stay out of the frozen entree part because that's really processed as well. The next picture is one of my all-time favorites, and it's a mystery snack. It's not even labeled by the FDA as a food because there's not enough real food in it. At the upper left-hand corner is a little pile of genetically modified corn, and the rest are goos and powders. And what they do is they take all of these different goos and powders and dyes, and they mix it up in these huge cauldrons, and then they put it in irregularly shaped molds so that it kind of looks like a food. Remember, a real food isn't perfect, it's a little irregular. And they bake it, and out comes a Dorito. It's kind of startling to think that that junk food aisle is actually not filled with food at all. It's filled with something the FDA labels as an edible snack. So most of that aisle, and think about it, a big section of the grocery store is filled with edible non-food things. So maybe you'll think twice before you eat that next Dorito. Look at your labels. If you don't recognize half the ingredients and it's filled with lots of different dyes and goos and powders, maybe in fact you're not eating food, you're eating an edible junk. Another question I get asked, well, what about diet soda? That surely must be better than the sugary stuff. Well, unfortunately, our culture has loved sodas. Luckily, neither of these ads are still available, but you can see the little baby. This is a real ad where they advertised 7-Up as a great replacement for milk. And then another Coca-Cola ad was basically promoting Coca-Cola as a much better, nutritious and delicious and refreshing drink for athletes instead of milk or water. So I think that our culture has grown up with these images of soda linked to health. And unfortunately, the sodas have become more and more refined. The pH of most sodas are between 2 and 3, the equivalent of white vinegar. So the next time you pop a bottle of soda, imagine drinking a bottle of white vinegar. It's a pure acid. It's great for the rust, not great for our insides, really bad for the brain, bad for stroke, bad for osteoporosis, bad for our teeth, bad for our gut, bad for our bladder. So basically it's good for nothing. I kind of put soft drinks in the same category as tobacco. Unfortunately, even though people like it, it's really not good for any part of health. This is probably going to be everyone's least favorite slide. This is part of the new recommendation. Lancet Neurology just put it out, a research paper showing the newest risk factors for Alzheimer's disease across the world. And unfortunately, the amount of alcohol that is beneficial is a lot smaller than we thought. We are so used to supersizing, and most of us would be pretty tipped if we saw a 4-ounce glass of wine being served to us in a restaurant. The amount that's beneficial is less than 14 units of alcohol. And please note that 14 units is not 14 servings. If you can see, a small wine serving can be between 1.5 and 2 units. So you can imagine it's basically less than a serving a day. So imagine having one small serving every other day or a few days a week. And of course, if you have a bigger serving, that very bottom picture is one small 1-ounce shot of alcohol. So if you have an alcoholic mixed drink, you can't put 5 shots and call it 1 unit. It's actually per ounce of alcohol, and the amount that's beneficial is very modest. So we might have to rethink that idea that moderate alcohol consumption is beneficial. It looks like the part that's good is very, very, very modest. So again, we're having to rethink the supersizing. And another risk factor that was just added, this was not in previous reports on prevention, was TBI or head trauma. And I know that we love our Vols and we love football, but the amount of force that occurs with the very best NFL helmet is 50 Gs. To put this into perspective, the very worst roller coaster ride is around 4 Gs. Humans can't tolerate more than 10 Gs for a minute, you would actually die because of the force that's inside your body. When these brains collide, basically it sends a shock wave that increases all of the pressure. So if you've ever seen people's roller coaster rides, we all look kind of stretched out, our faces stretched. It's actually the pressure on our chest, the pressure inside our bodies increases exponentially. So we do think one of the fundamental problems with sports where there's head collision is that repetitive head collision is repetitive extreme forces that our brains weren't really meant to withstand. So as we age, these kinds of forces are even more impactful. Sometimes it takes only one bad head trauma to kind of propel someone into an Alzheimer's symptom. So we've seen people that have had major falls and are starting to experience cognitive deficits. So again, it's not to say we should ban things. I think it's more to just educate persons that there's a really big risk with high impact sports. And even with padding, we can't get around the fact that there are these tremendous G forces that are occurring. So on a little more positive note, if we do the healthy lifestyle, if we exercise, if we eat well, if we quit smoking, it does appear to slow Alzheimer's by several years. So imagine just by leading a healthier lifestyle, we can put the brakes on Alzheimer's disease. Exercise in particular is the magic bullet. And how much do you need? Not that much. The amount that seems to be beneficial is around 150 minutes per week at more than 3 times a week, generally 4 to 5. And what age is too late to start? Well, if you look at this chart, the age during the study, there were individuals that were in their 90s. So the message is it's never too late. And if you look at the start age of the study, it's at age 65. So the idea is it's never too late to get off the couch, and it's never too late, even if you're using a walker, if you're in a wheelchair, you can do chair exercises, you can do chair weights, you can walk with that walker. So the idea is there's no age limit, there's no health limit to exercise. Just because you have physical limitations does not mean you should sit. So I encourage everyone to move, and it's not about weight loss. It's about actually moving, increasing some of the good brain chemicals that help fight Alzheimer's disease. Meditation, mindfulness, cognitive exercise also appears to be helpful. I wanted to also make note that the type of cognitive exercise that's beneficial does not include a whole lot of screen time. So I really encourage people to think about exercises and brain activities that you can use with pen and paper, games that you could play with other people, even meditation, prayer, mindfulness. Those are exercises that do not require a computer. So again, some of the activities that are most beneficial require other human beings or just a little bit of quiet time where you're reflectful. What about sleep? Here in the US, we are all sleep deprived. And unfortunately, sleep problems lead to plaque, lead to Alzheimer's. Fragmented sleep, meaning broken sleep, increases neuronal activity, meaning your brain never gets rest. Your neurons are firing all through the night. And then you get more plaque release and then amyloid deposition that causes more injury to sleep-wake brain regions. So you can see that there's a circle around and round, and having obstructive sleep apnea, that's the OSA, causes hypoxia, stress on the brain, also increasing Alzheimer's disease. This wheel goes around and around and around. So the more fragmented sleep you have, the more Alzheimer's, and the more Alzheimer's changes you have, the more fragmented sleep and more brain injury you have. So how do we stop this vicious cycle? Well, we treat sleep apnea. So treating obstructive sleep apnea can stop this. Also trying to have better sleep, not by using sleeping pills, trying to increase cognitive and physical activity. That also appears to help sleep, and trying to find ways to decrease inflammatory stress. This is a frightening picture of what happens after one night of sleep deprivation. The red shows beta amyloid, or that amyloid plaque accumulation after one night of sleep deprivation. That kind of light green shaded areas where the memory center is. And you can see that amyloid plaque is also present in the hippocampus or memory center after one night of sleep deprivation. Luckily, if you get a good night the next night, a lot of this is cleared. So the brain's only time to really repair is during deep sleep. So it's important for us to get sleep studies, and that sleep apnea evaluation and the CPAP or BiPAP or ASV is not because we actually are so focused on you feeling like you get a good night's sleep. I tell people 4 nights with that awful mask are better than 10 nights of no sleep. So the idea is, if you can sleep with that mask even some of the time, you're going to get real sleep, restorative sleep, better than you would feel if you didn't use it at all. So again, trying to be mindful that it's not about you thinking that you can sleep well. You're actually not sleeping when you have sleep apnea. Well, what if you fall asleep to your Kindle or iPhone or TV, and that's the only way you can relax your brain? That's sometimes what I hear. Well, if you can look at the very top, that is the spectrum of light. That's that top left of your iPhone. Do you see that big blue purple peak? That is blue light. And guess what? I've just put up a picture of what noon sunlight looks like. There's less, can you believe it? There's less blue light in noon sun than there is in our iPhone. And guess what happens when we see our iPhone at midnight? Our brain says, aha, it's the noon, it's the middle of the day. So because you're so exhausted, you crash into sleep, but actually your brain is tricked into thinking it's the middle of the day. So going to this diagram of a normal circadian rhythm, if we keep our devices on all through the night, even if our eyelids are closed, remember that light goes right through your eyelid. Our brain says, aha, it's noon. And what happens is we are so exhausted, we crash. We don't actually really get deep sleep. We just go into a coma, and here we are, we think we're asleep, getting good restful sleep. And then by the time we get to that yellow physical repair that says 12 midnight, it's actually time to wake up. So we never get to deep sleep. If you look at this chart, melatonin is suppressed by the blue light or sunlight. So sometimes people take melatonin supplements. That can be very helpful, but you also have to turn off your device. If you have any screen on and you're staring at it and you take melatonin, your brain's going to wash it out. So it's not going to do any bit of good. So it's important to set a time for your family and turn everything off. And I don't think we're going to turn things off at 6 p.m. We're likely at work still. So again, trying to plan at least an hour or two, more is better, where you turn everything off in the household. That can only help the brain. What about treatment? It really depends on the age and stage. The treatments that are against amyloid will benefit those that are in their 40s, 50s, and 60s and onwards. So those are the treatments that are in trial right now that are very hopeful, we think can stop the disease. But at each stage there's going to be a treatment. There are some treatments that are aimed at inflammatory disease. We just finished a trial for that, for the inflammation. That can be a great treatment for those in their 50s, 60s, and 70s. Treating the tangles, that's a little bit later. Treating the atrophy and symptoms. Well, we have good treatments for the symptoms right now, things like donepezil, memantine, rivastigmine, galantamine. But again, the focus is we would like to go backwards to the point where we're treating before there are symptoms. One of the most exciting things is it does appear to be a vaccine that will likely be approved sometime in the spring. And just like you've heard about the COVID vaccine, this is a vaccine that fights against the amyloid. It's an immunization against the plaque. It basically tags the plaque in the brain and sends a signal that latches onto the clumps, which then sends a signal to the immune system to break it up and flush it out. And on the right-hand side, you can see the results. And in the initial scan on the top, you can see all of this red amyloid plaque. And then after the treatment, the plaque is gone. In the placebo, that means in the one that's just neutral, it's just saline, it's just salt water treatment, there's no change. But the whole exciting part about this is that we may have vaccines to help fight against Alzheimer's and other different degenerative diseases of the brain. I wanted to thank my amazing team at Genesis Neuroscience Clinic, and we're in the process of becoming a nonprofit. And part of our mission is to mentor students and healthcare professionals and other people to become future providers in dementia care. And then we'd like to continue to provide high quality care for our patients. Thank you so much for your attention.
Okay, thank you so much, Dr. Crane. And as I mentioned before the presentation, that we would be leaving time at the end for question and answers. If you have a question and have the chat function, if you're doing this through your computer, please feel free to ask your question there. In just a moment, I will open the phone lines as well. If you are calling in on the phone, you can unmute yourself by pressing *6 on your phone. Again, that's *6 on your phone. I'll let you know when I'm unmuting in just a second. Before we get that, I see we have Dr. Crane with us. Thank you so much, Dr. Crane, for being with us today. The first question that has come through our chat is the following. Is carbonated water without flavor like seltzer acidic like soda?
Question about carbonated water. I think if we can still try to drink plain water, it is much better, but carbonated water is not soda. So remember, it's much better option. So yeah, that would be fine.
Great, thank you. We will now open the phone lines for questions. So I'm going to unmute everyone. Again, if you have a question, you can press *6 to unmute yourself. Let's see, hopefully this will work. Okay, anybody have a question for Dr. Crane? While we're waiting, Dr. Crane, I do have one question that has come through. When is the best time to get a diagnosis? I know you said the earlier the better. What is the process that someone needs to do to get a diagnosis? What are the steps they need to take?
So let's start with your primary care doctor and get an initial screening, or if you would like to be referred and you're having some memory problems, you can go ahead and get a screening. We do see people that have very minimal problems. Also looks like that plaque scan that I was telling you about earlier, the one that shows instead of having an autopsy, we can do a special plaque scan. That looks like it's going to be available again. So it's not actually an experiment. It's a great option. So we'll likely be able to offer them again this spring. So keep in touch. We'll probably keep in touch with you too and let you know if we have access to getting the scan. So for any people that are concerned, that amyloid scan, instead of having to pay thousands out of pocket, looks like what is going to cost $3,000 in the country to get a lot of those scans.
Great. Thank you, Dr. Crane. Again, if you're not asking a question, I would ask you all to mute yourself, please. I will do that as needed. Are a few more questions that have come through in the chat function. Can the damage from losing sleep be reversed?
So we think that damage from losing sleep can be reversed with good sleep hygiene, and also we can also reverse it through good sleep hygiene, getting a sleep evaluation, trying not to use sleep aids except for melatonin. So I don't need to use which blocks one of the normal brain chemicals that helps the brain process information. So avoid Benadryl, avoid some of those other sleep aids, and definitely take sleeping pills.
Great, thank you. The next question is, what is your best guess on when an Alzheimer's vaccine will be available?
So with the vaccine, most recently the FDA declined to approve it, but here's the way to look at it. Dottie, do you might want to mute everyone again? So
yes, sorry, I'm trying to figure out where the feedback's coming from. I apologize. Hold on one second.
I'll make sure everyone can hear you. I'm having trouble hearing too.
Yes, hold on one sec. Let me just.
Okay.
Okay, I think. All right, you can go ahead. I think we've got it.
Oh, wonderful. Hey, thank you, everyone. So in terms of the Alzheimer's vaccine, it was initially denied. And so I think it's going to be a bumpy road to getting the vaccine covered. I think that since it was denied last week, I think that they're going to rethink it and try to restrict who gets it. Again, remember, this is a long road. We have to recall that a lot of the cancer treatments also had a bumpy road to get approved. So I do think it's going to be approved sometime in the spring, but it will be very restricted to a small number of people. So again, keep in touch with you in the community. If we find that it's going to be available, we'll likely make an announcement. We're going to keep our fingers crossed, but look for that in the near future. I think that there will be a disease-stopping drug. So the people that will be eligible will be those with mild impairment, not those that have significant symptoms.
Thank you. And I think you've just answered the next question, which was about, can the vaccine be given to people who already have Alzheimer's, or is it more of a preventative measure? I believe you just answered that.
Sort of. You have to have biomarkers, so you will have to have that special amyloid scan. So like I said, I'm encouraging those. We will let the community know. I can also share that with you, Dottie. If since Medicare and the American College of Radiology are paying for a limited number of scans, we're going to hopefully do as many as we can here in Knoxville. So our clinic will be part of that. And if you have that positive scan, you will be eligible for a drug. So what's the rate limiting factor will be getting this special scan called the amyloid scan, because it marks the autopsy plaque. It's the only way you can see plaque is through this scan.
Okay. Thank you. Our next question is, are there natural or herbal products like ginkgo biloba or red panax ginseng good for brain health?
So in both of those products, it does not look like it's helpful if you have symptoms. So some of the herbal agents may be helpful in someone without symptoms, but once you have symptoms, it does not appear to be helpful. In fact, there can be some drug interaction. So we have to be very careful about drugs interacting with the herbal therapies. Remember, herbal therapies are still medications. Don't think of your vitamins as a non-medication. They interact with other medications just the same. I had a patient that had liver damage from too many supplements. So we have to remember that there is a danger with supplements. Generally, I recommend not reading your label very carefully. I think if there are plant-based supplements like turmeric, curcumin, ginger, those I think are quite good.
Okay, thank you. The next question, they keep coming in on the chat, so we're going to go through those. Does the advertised pill made from jellyfish actually work to help brain cells?
So I know that we are looking for hope and the treatment, but in our clinic, we spend more time stopping that particular medicine, or I'm sorry, that particular herbal therapy, because we don't know how it interacts. I have yet to see someone do even a little bit better. So I don't think it's a great option. I would rather stick with a supplement that has better evidence. Unfortunately, there was an FDA lawsuit against them for misinformation. So I think it's, again, I'm not saying it's bad. We don't know, but I don't like folks to take extra things that don't have a lot of evidence. Again, like if you can stick with some of the other supplements, I would prefer those supplements.
Okay. Our next question is related to stevia sweetened drinks like tea. Should they stick to unsweet tea versus the stevia sweetened drinks?
So I think a small amount of stevia is likely not terrible. And for those that say, I can't quit soda, I think any sweetened, artificially sweetened drink is better. So if it, let's say, it encourages you to drink water because you have a hard time drinking water, I'd say it's better than not drinking water. But if you can have some plain water during the day, that's ideal. So maybe have your stevia sweetened tea, but then pick a glass of water or maybe an unsweetened one as well. I think, again, it's all about the balance. If we don't know the long-term effects, stevia is probably the least offensive. Please don't pick the yellow, pink, and blue packets. Those are the bad ones. So stevia is probably the least offensive of them all. So I'm okay with small amounts. It's all about quantity.
Okay. I'm going to open it now. If there's anyone on the phone that has a question, if you can ask it now.
I have a question.
Go ahead.
Yes. My brother takes medication for his blood pressure. And if you're taking medication, will that help your body to resist the Alzheimer if you're taking blood pressure medication?
So we think that controlling blood pressure will slow decline. So absolutely, there is, we now understand that elevated blood pressure puts a lot of stress on the brain. So I think the evidence is so strong that at any age, if you have high blood pressure, treat it. And sometimes people say, oh, but that medicine makes me feel tired. And I'd say if there are other things you can do to help lower your blood pressure, do them. Like, for instance, if you have sleep apnea and you use your CPAP, that lowers blood pressure too. So I absolutely encourage people to take their blood pressure medications.
Okay, thank you.
Okay, does anyone else have another question they'd like to ask?
One more question.
Yes, ma'am.
One of the senior companions has a really bad hearing problem, but he refuses to get a hearing aid. And I'm concerned because he exhibits, memory loss.
Well, I think that if you could encourage that it would help his memory, I think that's a new reason to get a hearing aid. The information that it puts, hearing loss puts stress on the brain, is so powerful. It makes me a lot more excited about hearing aids than I have been in the past. So I would encourage everyone, if maybe a family member says you have hearing loss, to go ahead and get it checked. And you might encourage him to say, look, it's going to help your memory. And so we actually think, another thing is getting cataracts fixed also. So the idea is you have more information going into your brain. So like your eyes are receptors, your ears are receptors. The more information that comes in, the better.
I have a question. Hello?
Yes, go ahead with your question.
I'd like to know, my son is trying to teach me how to use the text, and everything, but
I'm not easy to comprehend. Is there a problem with that? Would it be my age or what? And I have another one little question. Each one wants to take long. Is there a problem with me understanding? He has to keep going over.
Well, with technology, it can be a struggle. If you're finding that it's other things as well besides the computer or your cell phone that you're struggling with, let's say it's a different task that you're having to relearn again, like sometimes people get a new appliance and can't figure out how to use that new washing machine or new microwave, that's a little more concerning. So you might want to get a screening, because I think we can try to prevent any more problems.
We
Okay,
have.
Okay, I have one more small one. It's very important after this one, but I didn't know if there was a problem with me that it's taking me longer to comprehend what he's teaching me. And there's other little problem I have is about smell, if you could answer it.
Yes, if you're starting to have problems with smell and comprehension, I think you should get that checked out. You might be fixable.
I did. I went to the doctor, and he said, now I can barely smell anything. Somebody will say, ooh, doesn't that smell bad? And I don't really smell it. And he said it was age.
Well, we used to think it was age. Now we understand that it could be more than that. So maybe you could ask your doctor to get an evaluation.
Okay.
Okay, thank you. And we have time for a couple more questions, and I'm going to go back to our chat. We've had some questions that have come in through there. The first is a couple of clarification questions. The first was about hearing about the turmeric and ginger as positive herbs, but wanted to have you repeat what the third one was that you mentioned.
Curcumin, which is related, but again, there are other anti-inflammatory foods. So thinking about food as medicine, eating your omega-3s instead of taking a supplement. Another thing to do is to eat fatty fish once a week. So instead of taking the omega-3, I do recommend eating one serving of fatty fish. And I saw the other clarification about the damage from sleep. If we correct our sleep, it does reverse some of that damage. So the great thing is that it's not too late. Our brain is still very flexible. There's still a lot going on. So it's not all of the damage accumulates and we can't stop it. So yes, go ahead and try to get a good night's sleep.
The next question in our chat is the following. My mother takes I'm not going to say it right, donepezil, prescribed to her from the neurologist for Alzheimer's. Can you explain more about this medication, if it's more to treat symptoms or if it's actually an enzyme blocker? And what's your option, or maybe opinion, I'm not sure what they mean. What's your option on this medication?
So there are medicines in the class, donepezil, rivastigmine, and galantamine, and all of them are cholinesterase inhibitors. A fancy way for saying they stop acetylcholine from being eaten up at the synapse. It is for symptoms. Dottie, do you think you can mute this again so we can hear?
Okay, I'm sorry. I wasn't hearing the same feedback, so let me do that. My apologies. It's this wonderful technology we live in now, right?
Thanks, everyone, for hanging in. This is a brave new world, so.
Okay, I think we are good.
Good. So it is an excellent medication. It is for symptoms. The drugs that I'm talking about in clinical trial are for cures. We have to think about it like this. You have a cancer, sometimes you take medicines that make you feel a little bit better, and then of course, chemotherapy makes you feel a whole lot worse, but that's to help cure. So it's the whole idea. The medicines that are going to help truly stop disease are not going to be fun medications that make you think better immediately. They're going to be pretty significant drugs. These immunizations are infusions. They're complicated. They're not easy things to take. The trial we just finished with Harvard, that was a large amount of medication that did cause stomach upset in some people, and had to be consumed regularly twice a day, and it was a complicated medication. So again, donepezil is excellent. We should continue the medicines that we have, but please be on the lookout for some of the ones that are coming through trial. The first cure, remember, the first cancer cure was in a trial. The first Alzheimer's cure will be in a trial. So we are so hopeful that one of these drugs is going to be the right one and will cure it.
Thank you. And I know that there is, I was very impressed by all the things I heard today. I think I'm hearing a lot of things from the chat as far as thank you. So I think that's a good place to stop for today. I want to take this opportunity to thank Dr. Crane for joining us today and sharing her wonderful, vast array of knowledge with us. So everybody can clap on their own, not that we can hear you, but we'll give you a virtual clap, I guess. So yes. So thank you all so much for joining us for Aging a Family Affair. This presentation has been recorded and will be available on our website in the near future, as soon as we can get it up there. So if anybody has questions, they can call our office at 524-2786 or visit our website at knoxseniors.org. So thank you so much, and thank you, Dr. Crane.
Thank you. Have a great day. Everyone enjoy. Thank you.